My name is Roman Lukashevsky. I'm the Senior Scientific Advisor for Dstl in support of the UK effort in West Africa. So Dstl is one of 3 centres that can handle Ebola virus in the UK. As such, we have the expertise in-house to advise the MOD and wider government about certain aspects of Ebola virus. This occurred in September of last year, where we were called upon to provide advice on decontamination policy. We were pleased to do that. Following that, our partners at Public Health England sought our advice and help over the provision of laboratories in Kerry town in Sierra Leone. We supported the provision of beds in Sierra Leone by undertaking modelling analysis of what the likely throughput of patients would be during the initial stages of the outbreak. Following this advice, it became clear that the UK government would need further support in deploying laboratories out in Sierra Leone, and we worked closely with our partners Public Health England, PHE, to provide laboratory facilities out in Kerry town.
I'm Laura Marshall. I'm one of 12 Dstl microbiologists who deployed to Sierra Leone within Public Health England's Ebola diagnostic facilities. We were testing patient samples, blood and swabs for Ebola, and we worked within the Kerry Town Ebola Treatment Centre run by Save the Children. Dstl staff are experts in working in high containment with dangerous pathogens. As part of our research, we develop medical countermeasures, diagnostics for dangerous pathogens, and that's our bread and butter. So we receive samples both from the community, for example from holding centres, and from the treatment centre that we were working in, and we were able to take those samples within to our facility, unpackage them safely and test the samples for Ebola using the polymerase chain reaction. It's a well-characterised diagnostic test for Ebola. Once the results came back to us, we were able to report them back to the treatment centre or back to the community centres where they could inform decisions on quarantine and on safe burial practices as well.
So we've been able to provide advice on how to test for Ebola, not only in the laboratory but out in the community. We've transitioned one of the prototype technologies that we've been developing at Dstl into a lateral flow device that can be used out in the community. It works very similarly to a pregnancy test kit. In this instance, you use a finger prick of blood, dab it onto the device, the blood travels up the device, and if Ebola virus is present, then it gives a positive result which can be read by a non-expert user. This informs the user as to potentially what action should be taken with the individual that is given the blood sample. We work closely with our partners at PHE and a company called BBI to develop prototypes that were tested at PHE, Dstl and in laboratories in Sierra Leone. To date, 10,000 of these devices have been produced. They work very quickly, giving an answer within 20 minutes and are very simple to use.